So there's been a lot of interest in bariatric surgery as a means to treat both weight and to treat and prevent type 2 diabetes. Bariatric surgery has been associated with substantial and sustained weight loss, and there are multiple different sorts of procedures that the surgeons can do, and the magnitude of weight loss that's associated with each of the procedures differs to some degree, but is better and better sustained than much of what we can do through lifestyle and medical management. So it's been observed that following the procedures that a large number of patients who actually have diabetes will actually have marked improvement in their blood sugars, and some of them are actually able to go off all of their medications and stay off their medications for a prolonged period of time, suggesting that they have remission and prolonged remission of their diabetes. The different surgeries are associated with different remission rates, and some are actually associated with very early changes in multiple hormones that may actually help promote the metabolic changes that are seen. So the hormonal changes with some of the procedures that actually alter the gut or the connections of the stomach to the intestines are associated with changes in hormones that regulate appetite and satiety. They're associated with changes in hormones that actually regulate insulin secretion and changes that regulate the fuel fluxes as well. It's interesting that the surgical procedures not only lead to improvements in blood sugars, but they also lead to easier to manage blood pressure and lipids, and this may be associated with longer term benefits to cardiovascular effects, adverse events, or to improved survival. And carefully performed cohort control studies suggest that there's actually improved survival for individuals who've previously undergone bariatric surgery. The problem with these studies is that they're not randomized, and so there are potential biases why a person who might be healthier might be more likely to choose to have an invasive procedure like bariatric surgery, or where the physician may be more likely to support the patient going to the procedures. So it's very important to actually begin to have randomized controlled trials to actually substantiate the benefits that have been seen in these observational cohort studies. And these trials are now beginning to come to fruition, and several of the trials are now at the 1 to 5 year landmarks and are beginning to demonstrate again improved weight loss, improved remission of the diabetes, and improved markers of metabolic health that may portend future really important clinical outcomes like improved mortality.